cancer that we're talking about. And what happens is, as you heard, we come in at 2 stages. So the initial stage is when we take a small piece. We first want to establish, number one, is it a cancer? And if so, what is it? Yeah. And then based on that, we then decide, do we go in and remove the bigger section of it? Because we've just taken a very small piece. And that's what we call an incision biopsy. When we go and remove the whole tumor, we then call it an excision biopsy. And that's why it's a very intense, multidisciplinary team approach when you're doing cancer, because the surgeon is involved. Inakuwa juu. Yes, so you have the surgical procedure, you have the biopsy being brought to us. When we receive this biopsy, we have to establish what cancer is it, number one. And we have to do what we call subtyping. As I said, we have different modalities of treatment for the different types of cancer. For example, for breast cancer, we have almost over 20. So we have to establish exactly what type. And so one of the warriors talked about ductal carcinoma. That's just but one of the types. So we have to establish what type it is. And we have to go into very expensive testing. We do immunohistochemistry and other tests. And this is why gharama inaju.
Na ndio maana nikauliza, hatujafikia mahali tuna teknolojia. Badala mgonjwa aje kile wakati unapompima kujua stage, lazima umpeleke katika chumba cha operesheni. Hapo kuna gharama. Hakuna njia ambayo tunaweza kuwa na teknolojia ambapo sio lazima mtu kukatwa sehemu fulani ambao gharama yake iko juu.
So sasa we have the cryosurgery, the surgical therapy that is now available in KU, and the liquid biopsy, and we also do FNA biopsy. Not all require surgery, and this is why it's hard to generalize cancer. All cancers come with their own specialized treatment. We can't generalize. But it's true, some do not necessarily require full surgery. If it's benign, it may require just management with drugs, and that's it.
I mean, let's talk about how cancer treatment has evolved over time. Dr. Catherine, I'll come back to you. What have we found in terms of how maybe ethnicity plays a role in how individuals would respond to medication? And are we